Hello, my name is Jennifer Carlisle, Assistant Professor of Thoracic Oncology at Emory University Winship Cancer Institute. I am pleased to review the 3-year update from the CheckMate 227 trial presented by Dr. Suresh Ramalingam at the ASCO 2020 annual meeting. CheckMate 227 compared Nivolumab plus Ipilimumab to Platinum-doublet chemotherapy as first-line treatment for advanced non-small cell lung cancer. The combination of Nivolumab plus Ipilimumab is effective in reversing T-cell exhaustion and inducing anti-tumor T-cell responses, and is used in other solid malignancies, including renal cell carcinoma and melanoma. This regimen was recently approved in the United States for frontline non-small cell lung cancer patients with PD-L1 expression of greater than or equal to 1% and no targetable EGFR or ALK aberrations. The initial results have been published in the New England Journal of Medicine. This updated report includes extended follow-up of a median 43 months. The CheckMate 227 study schema shows that treatments were randomized based on PD-L1 expression of greater than or less than 1%. For the greater than 1% group, patients were randomized to NIVO plus Ipi, chemotherapy alone, or NIVO alone. For patients in the PD-L1 less than 1% group, they were randomized to NIVO plus Ipi, chemotherapy alone, or NIVO plus chemo. Nivolumab was given at 3 mg per kilogram every 2 weeks. Ipilimumab was given at 1 mg per kilogram every 6 weeks. Treatments were continued for a maximum of 24 months for the NIVO plus Ipi. The chemotherapy for non-squamous histology was platinum pemetrexed with optional pemetrexed maintenance, and platinum plus gemcitabine for 4 cycles in patients with squamous lung cancer. Squamous histology was seen in 28% of patients in each arm. The patient baseline characteristics were evenly balanced across the treatment groups, with approximately 1/3 PD-L1 expression less than 1%, 1/3 in the 1 to 49% range, and 1/3 greater than 50%. The 3-year overall survival rate was favorable with NIVO plus Ipi at 33% compared to 22% in chemotherapy in the PD-L1 greater than 1% group. The median overall survival with NIVO plus Ipi was 17.1 months compared to 14.9 months with chemotherapy. This corresponded to a hazard ratio for overall survival in the PD-L1 expressor group of 0.79, which remained consistent with previous reports. In green, you can see the NIVO-only arm, which had a median overall survival of 15.7 months and a 3-year overall survival of 29%. Favorable 3-year survival rates were also seen in the PD-L1 less than 1% group with NIVO plus Ipi. At 3 years, 34% of the patients treated with NIVO plus Ipi were alive compared to 15% of patients treated with chemotherapy and 20% of patients treated with NIVO plus chemotherapy. This corresponded to a median overall survival of 17.2 months in the NIVO plus Ipi arm, 15.2 months in the NIVO plus chemo arm, and 12.2 months in the chemotherapy arm. The hazard ratio for overall survival in this PD-L1 less than 1% group for NIVO plus Ipi was 0.64 compared to chemotherapy alone. Here you can see the response characteristics, which show objective response rate ranging from 23 to 37% across all the treatment groups. On the left, you can see that PD-L1 expression greater than 1%. Patients treated with NIVO plus Ipi had a median duration of response of 23 months, compared to 15.5 months with NIVO alone and 6.7 months with chemotherapy. On the right-hand side, you can see in patients with PD-L1 expression of less than 1%, the median duration of response was 18 months with NIVO plus Ipi, 8.3 months with NIVO plus chemo, and only 4.8 months with chemotherapy alone. Here you can see exploratory landmark analysis to study the impact of response on overall survival. A 6-month time point was chosen because most of the responses in each of these arms occurred by that time point. As such, patients who expired before 6 months were not included. On this slide, you can see patients who achieved complete or partial response at 6 months in the PD-L1 greater than or equal to 1% group on the left. In those patients treated with NIVO plus Ipi, the 3-year post-landmark OS rate was 70% compared to 39% with chemotherapy and 63% with Nivolumab alone. On the right, in the PD-L1 less than 1% group, you can see that patients treated with NIVO plus Ipi achieved a 3-year post-landmark overall survival rate of 82% compared to 25% with chemo and 43% with NIVO plus chemo. To emphasize, we can see here that patients who achieve a response with NIVO and Ipi have a 70 and 82% possibility of surviving post-landmark 3 years in the PD-L1 greater than 1% group and less than 1% group respectively. Treatment-related adverse events that led to discontinuation of treatment was noted in 18% of patients on the NIVO plus Ipi treatment arm compared to 9% in the chemotherapy arm. Nivolumab and Nivolumab plus chemotherapy groups were somewhat in between at 12 and 14% respectively. Here are summarized immune-related adverse events of particular interest in the NIVO plus Ipi combination. You can see on the vertical axis the percentage of patients who developed a certain toxicity and the 6-month time period on the x-axis. What's shown here is that the majority of these specific AEs of interest with NIVO and Ipi occurred within the first 6 months of therapy, and once patients passed the 6-month period, the incidence of these autoimmune adverse events minimize. This supports continued treatment for the maximum 24 months of therapy in patients who are achieving benefit. To summarize, CheckMate 227, now with a minimum of 3 years of follow-up, shows that frontline NIVO plus Ipi continues to provide a durable and long-term efficacy compared to chemotherapy for patients with advanced non-small cell lung cancer, regardless of PD-L1 expression. The 3-year overall survival rate was 33% with NIVO plus Ipi compared to 22% with chemotherapy in the PD-L1 greater than or equal to 1% group, whereas 3-year OS was 34% with NIVO plus Ipi compared to 15% with chemotherapy in the PD-L1 less than 1% group. Among patients with PD-L1 of greater than or equal to 1%, 70% of responders at 6 months are alive 3 years later, compared to only 39% in the chemotherapy arm. A similar benefit was seen in patients with PD-L1 less than 1% in the exploratory post-landmark OS analysis as well. There were no new safety signals identified. This is a dual immunotherapy regimen that spares chemotherapy and is now an approved frontline treatment option for advanced non-small cell lung cancer. Thank you for your attention.